Smoking is one of the biggest causes of accidental fire deaths. Are you doing everything to prevent your care service, staff and service users from the dangers of smoking? Here, we give an overview of the law and your regulatory requirements, plus our advice on how to balance the protection of your staff, visitors and service users with meeting the rights of your residents. Residential care homes for adults are exempt from smoke-free legislation. Across the UK, general regulatory stances are that where a service user chooses to smoke, it's important that appropriate arrangements are put in place to facilitate that choice, but that it must be done in a way in which ensures the safety of the service user and those sharing the accommodation. Smoking by non-residents, including staff and visitors, should be dealt with in line with regular smoke-free legislation. If indoor smoking rooms are available, you must ensure that the designated room has a ceiling and is completely enclosed by solid floor-to-ceiling walls on all sides, apart from windows and doors. The room must be ventilated with a system which does not ventilate into any other non-smoking area of the premises. The room should be an enclosed space, not at one end of a large room, for example. Smoking rooms must be clearly marked, and smoking in these rooms must be permitted only for residents and never for staff or visitors. If you are unable to provide a room in line with the above, the building must be smoke-free in order to protect residents and staff from second-hand smoke. Outdoor smoking areas should be sheltered and reasonably comfortable, easily accessible by routes which are level and hazard-free. Bedrooms must not be for smoking unless the service uses individual risk assessment has deemed them as a low level of risk. If this is the case, the room must be properly ventilated to the standards required of any smoking room and be properly equipped in line with the following slide. For further safety, smoking areas must be equipped with fire retardant furniture, fabrics and finishes, smoke detectors and alarms, fire extinguishing equipment including fire blankets, and safe ashtrays, preferably metal. A unique risk assessment should be done for every service user who wishes to smoke. It's important to balance the assessment with considerations of the service user's needs and the wider impact of fire and the health and safety of the care service. You must include the service user, their family and visiting friends when carrying out the assessment. Consider the mental capacity and physical ability of the service user with regards to smoking safely. Consider the increased risks to service users with specific needs like dementia or learning disabilities. Consider the risks to other service users, visitors and staff, like fire and second-hand smoke, for example. Identify whether the service user is safe to smoke without endangering themselves or others, and review the risk assessments regularly. Annually is fine unless there's a change in need. Some other considerations. To keep exposure to a minimum, staff should be required to spend as little time as possible in smoking areas to protect their own health. Staff with health conditions made worse by second-hand smoke shouldn't be asked to enter smoking rooms whatsoever. And residents should be reminded sensitively of the dangers of smoking to gently encourage them to stop smoking to better their health. Many creams used to treat skin conditions such as eczema and psoriasis have been found to have caused deaths when combined with fire from dropped or not properly extinguished cigarettes. The creams can contain up to 95% paraffin and other flammable components, putting the user at high risk of severe burns, especially when the creams are used on large areas of the body. And it's not just direct areas of application which are a cause for concern. Further risk comes when bedding and clothing are contaminated with the substances. The flammable components act as an accelerant should the material come into contact with fire from a lighter, cigarette or ash. There are a number of things you can do to prevent harm. Where possible, switch to a non-flammable alternative cream or lotion. If an alternative isn't possible, where more than 100 grams of emollient is needed, use a water-based product like a cream or lotion rather than a paraffin-based one like an ointment. Do not allow service users who use the creams to smoke or use naked flames of any kind. Never allow service users to smoke in bed. Make sure fabrics are fire retardant. Change clothing and bedding regularly. and wash fabrics which have been in contact with the creams in a biological washing powder. If you'd like any further information about fire safety within your care service or about how Citation can help you with health and safety as a whole, call us on 0345 844 1111 to speak with an expert today.